Hi there, I'm Christy Wood-Giles, and you may know that I have decided to trek across Ontario this spring and summer along the Trans-Canada Trail to provide more awareness about better prevention and treatment for Lyme disease. Unfortunately, as of recently, I've been interviewed 3 times by the media to try and share some of the information I want to get across to you. And in all 3 occasions, the information has been cut. Even the slightest reference to some of the treatment information has been eliminated. So I realize that I'm not actually getting the message out there that you need to hear. So I want to take this opportunity to make this video. You may find that it's long, but I encourage you to listen to the end because it could be the best information you ever receive to protect your health. And I also encourage you to share it widely. Everybody deserves to know this information if they have the risk of having a tick bite. So I'm going to try my best to go through it and give you the most concise version of the information that I can. And I sure know what you're saying is, who is she to give us this information? And you're totally right. I'm just a Lyme advocate. I have chronic Lyme. I was in park management for 2 decades and had special training every year by the best of the best, and yet I still ended up infected, misdiagnosed, and having to travel to the US for treatment. So I want you to know what I have since figured out are the flaws or gaps in the system that are causing this to happen. And with the information that I'm going to share today, it's based on provincial and federal reports, the latest of those reports, as well as medical guidelines and medical interpretations. So I think it will give you everything you need to know. So what I want to start with is the most recent provincial document, which is the Report of Lyme Disease and Tick-Borne Illnesses Task Force. It was a group of experts and patient advocates that was put together and worked with the Ministry of Health and Long-Term Care to try and figure out where the gaps were and some direction for future activity. And so I want to refer to their care, treatment, and support reference where they talk about how we must do a better job of communicating with regulated health professionals that Lyme disease incident rates are increasing in Ontario, and that diagnosis and treatment of suspected cases of Lyme disease should be based primarily on their clinical and professional judgment and not based solely on blood test results. So they're trying to encourage doctors to react to the clinical symptoms of Lyme disease as well as the presence of a tick bite, rash, or any other symptoms for treatment. So where that continues, it says advocacy groups and patients report that physicians may not consider a Lyme diagnosis for several reasons. In these instances, patients are put in a position of having to advocate for themselves when it comes to obtaining a diagnosis, interpreting test results, and or having to make a case for treatment. So that is why I am here. You need to advocate for yourself. It also goes on to say it's important that patients are involved in discussions about their treatment course. Patients should be aware of the benefits and potential side effects of all treatment options so that they're in a position to make informed decisions about their care. However, what's happening is actually all treatment options are not being shared with you because they're also not being shared with all of the medical professionals. So that's really the intent of what I'm going to do today. Is share that with you so that the next time you end up having to speak to your doctor about care after a tick bite, the 2 of you will be able to base it on all the medical guidelines and information available. So in the same provincial report, and I'm also going to give you the federal version, it goes on to say that they need to conduct a review of current clinical practice guidelines focused on the assessment, treatment, and prevention of Lyme disease and other tick-borne illnesses. The reason being, and they say in North America, there are currently 2 major clinical practice guidelines in use. The first one is Clinical Assessment, Treatment, and Prevention of Lyme Disease, and this is published by the Infectious Disease Society of America. This is the one that your basic guidelines for treatment are based on in Ontario. However, there is also a second that they reference here, the Clinical Management of Known Tick Bites, Arrhythmia, Migraines, Rash, and Persistent Disease, published by the International Lyme and Associated Diseases Society. You deserve to know about these as well as all medical professionals. It's in the provincial guidelines as one of the 2 medical guidelines for tick-borne diseases, and nobody knows about them. As well, in the federal framework on Lyme disease, they refer to that there are a small number of frontline health professionals who follow guidelines developed by the International Lyme and Associated Disease Society, otherwise known as ILADS, a multidisciplinary medical society dedicated to the diagnosis and treatment of Lyme and associated diseases. The treatment recommended in the ILADS guidelines are different from those of the Infectious Disease Society, particularly with regards to antibiotic use. There remains gaps which can be informed through further research or treatment options. Emerging evidence will be closely monitored and shared with patients, medical professionals, and other relevant stakeholders. This is in the Canadian Federal Framework for Lyme Disease Guidelines. And what's amazing is the ILADS guidelines actually compare the 2 different forms of treatment and allow for you to look at the different results and potential considerations in both. So I am going to go through all of those. So here are the International Lyme and Associated Disease Society guidelines that you can get online. They refer to a lot of the considerations in treatment. The first one being the big one that's applied in Ontario is the single dose of doxycycline as a prophylaxis after a tick bite. And what they say in a piece of the guidelines is that the first recommendation is that clinicians should not use a single 200 milligram dose of doxycycline for Lyme disease. It's because the evidence is very low quality to support such treatment. The reason being is that it was based on one study that was not very successful and actually only prevented the Lyme rash. It does not prevent Lyme disease. And you can see an article by Dr. Daniel Cameron, the article is Single Dose Prophylactic Treatment of a Tick Bite Only Prevents Lyme Rash. And that was also only prevented Lyme rash in 8 out of 10 patients. So even at doing that, it wasn't very successful. There is zero evidence that it actually prevents Lyme disease. This is the single dose of doxycycline after a tick bite. So the recommendation is that clinicians should promptly offer antibiotic prophylactics for known tick bites in which there is evidence of tick feeding. So that means there is some level of engorgement in the tick and it's attached, and regardless of the degree of tick engorgement. So it doesn't need to be fully engorged or attached for 24 hours or all of these other criteria that we add to it. And then it says other treatment options may be appropriate. Most patients will place a high value on preventing chronic illness. So the idea is longer antibiotics than the 1 day if you're placing a high value on preventing chronic illness. Some patients will avoid unnecessary antibiotic and prefer not to treat a tick bite at all. But that basically the recommendation is 1 to 200 milligrams of doxycycline twice daily for 20 days, if this is the preference. These are in the ILAD guidelines. And then it goes further on to say that in some cases where there is rash or Lyme symptoms, treatment regimes of 20 or fewer days may not be recommended, and that the failure to fully eradicate the infection may result in the development of a chronic form of Lyme disease. So meaning, if there are symptoms of Lyme disease, you may actually have to treat for more than 20 days in order to make sure you eradicate the bacteria. And that is supported by studies that were just published last year by Embers. And the reason being, the studies showed that after 28 days of antibiotics, Lyme could still be found in the body, so that it has the potential to persist after 28 days of antibiotics. So the ILADS guidelines go on to say that initial antibiotic therapy in the case of symptoms of Lyme disease should employ 4 to 6 weeks of antibiotics, and they go on to include recommended dosages and types of antibiotics that can be included. So what I am trying to say here is that there are other guidelines out there. There's the infectious disease, which suggests 1 dose after a tick bite and a maximum of 2 weeks with symptoms. There are the ILAD guidelines that do not feel that the evidence to support the 1-day dose are good enough to protect you, and that 20 days may be appropriate, or with symptoms 4 to 6 weeks should be appropriate. And the other thing that should be known about these guidelines is the ILADS guidelines that have the stronger set of antibiotic recommendations are the only guidelines that have been approved by the Institute of Medicine's National Guidelines Clearinghouse. They are the only ones that have abided by all the regulations and fulfilled them so that they are recommended. Yet here in Canada, our medical professionals are only advised of the one set of guidelines, although our provincial and federal documents reference both. So what I want you as potential patients to know, you need to know about the second set of guidelines, ILADS, ILADS guidelines, so that when you want to see your doctor after a tick bite, you can both have an informed discussion and have a joint effort in making decisions on your appropriate treatment care. I wish you health and safety in the great outdoors, and I believe it can be yours now with this information.